Good morning student. So my name is Sonam Mishra and I am assistant professor in Rama University. Today I am going to a small overview of the topic that is route of drug administration. So what is drug administration? Firstly I want to define you that what is route of drug administration. That is route of drug administration is the path by which a drug, fluid और any other substance that brought in our body. So कोई भी सब्सटेंस है या फिर कोई भी ड्रग है कि वो हम ले रहे हैं अपनी बॉडी में कि वो किस तरीके से काम करती है, तो उस कॉन्टैक्ट में लाने के लिए कि हम किस पाथ से ले रहे हैं, किस तरीके से ले रहे हैं, तो हम इसमें डिफाइन करेंगे द रूट ऑफ ड्रग एडमिनिस्ट्रेशन वेयर वी एनालाइज दैट हाउ वी ड्रग इनटेक and what factors affect to the route of drug administration. So first is the drug characteristics, where we analyze the drug appearance, that is availability, how is its physical appearance, that is in solid form or in a liquid form or in parenteral form. So we analyze the drug physical appearance. So the next is ease of administration, where we analyze that any person can easily take their drugs. So we can analyze according to the many childs and many adults person or any aged person that we can't able to take solid dosage form, so we can use syrups and parenteral kind of drug that we can inject directly to the body. So the third is site of action. We analyze that the drug is reached on the particular site where the disease causes, like any part of the body that cause any kind of irritation or any kind of problem, so the drug is reached on that site or not. The next fourth thing is onset of action, where we analyze the time taken drug response, that after how much times drug start response that we take any drug like on any disease, that how much time it take to take response to cure that disease. The next is duration of action, where we analyze the time between the onset or termination, where we analyze that when we take any drug for the any particular disease or any substance we take, so how much time it take to reach on that onset of site, and how much after how much time it get terminate, that how much time it get release or exit from our body. The next thing is liver or kidney disease. So when we give any drug to the any patient or any person, so we must have to sure that that person should not have any kind of disease that is liver or kidney. The next is channels of drug administration. So how we can give any drug to any patient or anybody. So by the internal route, by the parenteral route, by the topical route and by the transdermal route, we can give the drug to by these paths. So in the internal path we can give orally drug, we can give the drug orally, buccal, sublingual and rectal. So in the parenteral route we can give the drug by the intravenous, intramuscular and subcutaneous, intraarterial, intraarticular and intraethical. The next is topical. Topical route we can give the drug by the skin, ear, eyes and lungs and nose. And the next is transdermal, where we can give the drug by the skin. We are using many patches for the inject any drug by the skin layer. So the internal route we discuss about how we take the drug directly to inside the body. We can use these paths like oral, sublingual, buccal and rectal. So in the oral we give the drug directly to the mouth like tablets, capsules, syrups and solution. In sublingual we give the drugs by keep it under the tongue. We keep this kind of drug that already dissolve and directly reach in our body. In the blood circulation, after that it reach to the blood circulation. So in the buccal give the drug by keep it on the gum and under the cheeks. So in the buccal route we give the drugs that we keep in on the gum, on the upper part of the teeth and under the cheeks. The next is in this route we in the rectal form we give the, in this form a drug is mixed with the waxy substance that dissolve after inserted into the rectum. So in this kind of rectal route we insert the drug to the rectal part of in the body, where we are using many kind of suppositories. But so these suppositories are prepared by the waxy substance, and they slowly dissolve in our body. The next is parenteral route, where mostly the drugs are available in the liquid dosage form. These drugs are inserted or infused. These drugs are inserted by needle. So the first way to insert the parenteral drugs, that is intravenous, second is intramuscular, third is subcutaneous, fourth is intraarterial, next is intraarticular, and then last is intrathecal. So in the first intravenous we inject the drugs to the we directly inject the drugs by the needles to veins. In intramuscular we inject the drugs to muscles. In subcutaneous we inject the drug directly to the skin, and the next is, that is intraarterial, we inject the drug to the arteries, and next that is intraarticular, we inject the drug directly to the joint, that is knee or that is hand joint. So we can directly inject these drugs on that point. To mostly these injection are used to quick relief of pain. Next is intrathecal, that is we insert the drug directly to the spinal canal. Next is topical. In the topical route we are mostly use the drug on the skin or apply to the skin, that is three-way: skin, ears, eyes and lungs and nose. So in skin we are using cream, ointments, gels, and for the ear and eyes we are using drops and solutions. For the lungs and nose we can use spray, and many gels are also available, but sprays are most kind of we are using spray. In the transdermal route we are using to inject the drug by skin. In the transdermal route we are use many kind of patches and bandages on the skin. So when we apply any drug on the bandages, so we can, when we put those bandage on our skin, so they slowly absorb by our skin and react according to the body and treat that disease or any problem. So this topic is completely done. So we will meet in the next topics. Thank you.